Have you ever asked a coworker a question or asked them for help and they just ignored you? Maybe rolled their eyes first and then walked away. On this episode of Coffee and Conversations About Nurse Bullying, we're going to talk about how to handle being given the silent treatment. Hi, I'm Dr. Renee Thompson. I'm the CEO of the Healthy Workforce Institute. Welcome to Coffee and Conversations About Nurse Bullying. Of all the bad behaviors we see in healthcare, eye rolling, favoritism, exclusion, mocking, all of those. In my opinion, one of the most concerning behaviors to me is when nurses give each other the silent treatment. Why do you think this is so concerning? Well, because when anyone on the healthcare team, anyone, is not willing to speak to someone else, it puts patients, someone's mom, husband, or child at risk. Several years ago, a nurse shared a story that basically made me sick to my stomach. She was brand new, just off of orientation. She worked daylight, but needed to work a night shift. It's a story, okay? So she could have a day off for her family event. Although she was nervous about working the night with the night nurses because they had a pretty bad shift wars in her department, she thought, well, how bad could it be? Well, apparently those night nurses got together and they all agreed to ignore her. Seriously, anytime she asked a question or asked for help, every single nurse turned their backs to her and completely ignored her. Oh, did I tell you that this was a neonatal intensive care unit? So what can you do? If someone is giving you the silent treatment, here are a few things that you can do. Number one, just name their behavior. I just asked you a question about a patient and you're ignoring me, or you could say, or you're giving me the silent treatment. Name it. Number two, always try to align someone's behavior to a patient. You could say something like this: if this was your mom, spouse, baby, would you want your nurse to be ignored if she asked for help? Okay, align it to that patient. Number three, put your curiosity hat on. You can say, is there a reason that you're giving me the silent treatment? Or is there a reason you're ignoring me right now? Okay? Because here's the deal. I don't care if you despise someone. In healthcare, where the stakes are high, it is never okay or justified to ignore somebody on the team. Giving someone the silent treatment should truly be a never event because it's putting patients at risk. So are there any tactics that you use when faced with the silent treatment? If so, I'd love for you to put your comments in the section below. And if you're dealing with bullying and incivility at work, please don't ignore it. Please do something. Here are a couple of options. First of all, you can just head over to my website, healthyworkforceinstitute.com, where you will find a ton of great resources. Number two, you can join my community of other nurses who actually support each other. And three, of course, make sure you subscribe to this video series where you will learn simple strategies to stop bad behavior in your workplace. So until our next conversation, be kind, take care, and stay connected.